All right, guys, welcome back. Welcome back. All right. So next thing that we want to look at is our tools. Okay. Now it's really important that you get familiar with the different tools that we use here at Your Senior Benefit Solutions, because those will allow you to um, basically perform your job on a daily basis and actually get answers to questions that you might have and provide solutions to your clients. Okay. Now, just as with some of the other slides, I'm going to ask you to be patient with me. This is a step-by-step and a breakdown where I have a couple of screenshots in here, so it's going to look a little overwhelming, or it can. But remember, I'm also recording the training on the actual tool site. So for instance, Sunfire, the carrier comparison tool, I will have the breakdown of what it does, etc., for you on this PowerPoint so that you can have access to the PDF document. But at the same time, I have recorded a live training on how to maneuver through Sunfire, and we will do the same together as a team. We'll go over that as well. So we'll do live training sessions where we are able to play with it. Because again, not everyone learns by just reading. A lot of individuals, including myself, I more so understand and learn better when I'm able to see it right in front of me, right? More so the learning by doing. That's like how I operate and what works well for me. So again, just be patient with me. Please don't feel overwhelmed here. And if you do, it's totally normal, but you will get this information one way or the other. And that's why we're going to have multiple ways to skin the cat. Okay. Awesome. So let's take a look at it. If the computer, all righty. So the first one that I'd like to go over, the first tool is Sunfire. I've mentioned before that Sunfire is our carrier comparison tool. It does have the ability to do text messages, emails, and it basically allows you to send text messages and emails in order for you to send the client the scope of appointment, okay? So that they can text, basically they receive a link, and I'll show you exactly how it works, and I have it broken down, and then they can open the link and they can apply their signature, and therefore you are safe and secure, you are compliant, and you now are authorized and allowed to go over the specific plans. All right. But it is also our MA and MAPD enrollment platform, as well as if you want to do a prescription drug plan, you are able to do that as well there. Okay. And not to mention, lastly, it does allow you to check on medications as well as the formulary. I had mentioned in the previous video how the medications fall into about 5 categories. Some of them will never get into one of them if they're too much of a specific medication, like a brand name that is super expensive. Sometimes none of the insurance companies actually fit them within the category. So I'll show you what that means. Okay. All right. Now, how does Sunfire work? Sunfire allows the ability to view plans available by carrier, special needs, zip code, and county. Okay. So you have to, and I'll show you, it's going to be all very, very specific. The more detailed you are, the better answers you will get what's available. All right. Sunfire also allows you to select and compare up to 3 plans next to each other, meaning side by side. So you have a plan here, a plan in the middle, and a plan to the right-hand side, which is great because you can then see vertical, like, okay, how much does the client get in, for instance, dental, right? With plan A, B, and C. And that way you can say, oh, this one is much better. I'll be honest, like without Sunfire, I don't know what I would be doing. Okay, because it alleviates a lot of the pressure from us being able to do our job. Now, Sunfire allows you to review the summary of benefits, oftentimes the evidence of coverage, along with the star rating for the plan. Okay. Given that the plan is not too new, because if it's too new, it probably doesn't have a star rating. Sometimes it doesn't have an evidence of coverage, but usually most plans have the summary of benefits. And what the summary of benefits is, guys, as it says, it's a summary of all of the benefits. So if you're on the comparison tool and on the main page, you do not see all of the information listed, it's a PDF that's attached to the summary of benefit, to the actual comparison tool at the bottom, and I'll show you that. and you'll able to open that and then do Control F for find, right? And that way you can search for dental information if you're trying to see if a crown is covered. Oftentimes that information will be either within the summary of benefits or in the evidence of coverage, more detailed listed, okay? And then also, if you want to check if somebody is eligible for a specific D-SNP plan or C-SNP plan and what level of Medicaid they need to have to be on it, you want to do the same. You want to go to the summary of benefits and then search for that. It's usually on the first 5 to 6 pages, depends on the carrier. And that will then show you what is required to be eligible for this plan, what level of Medicaid, okay? Again, I will do all of this in person where I'll go and walk you through and I actually bring this up on the screen, okay? Now, use Sunfire as a prospect. Use Sunfire for any prospect that is capable of text and email signature for either the scope of appointment and or de-enrollment, okay? We went over how to conduct a telephonic enrollment with the 3 main carriers that we use. If you haven't seen that video, just take a look at that. And if somebody is capable of doing text message or email signature, meaning they're able to open a link and able to type in their first and last name, that's really all that is, then you want to go the Sunfire route. It's much easier, okay? And then just a couple of do's and don'ts, guys. When you create an account, I used to start off by having a dummy account, which I still do, under your name, and I'll show you how you can just create one. That allows you to just simply do a quick comparison, okay? Always enter the client zip code and county, as well as because all plans are zip code and county specific, as I mentioned before. If you make the mistake and you choose the wrong county, there might be different plan options that come up. If you enroll that member into that plan, CMS very likely will catch it and will not approve your application, and therefore the enrollment will not go through, okay? So if there's only one county coming up, then clearly that client very likely lives in that county, but it never hurts to ask. If there's multiple counties or nothing is coming up, you always want to make sure, okay? And then also ensure you input the client has LIS, which is the Extra Help program, which will help with the monthly premium plans and the medication cost, okay? I will break down what that means, but basically when you're on the page where you enter the client's zip code, medications, etc., if you scroll all the way to the bottom, there's going to be the last question if the client currently has any level of extra help. You would then check the yes box and then it'll ask you what's the percentage. And remember, I went over the video in United Healthcare's Jarvis on the Medicare eligibility lookup tool. You are able to go in there and see what the percentage is by putting in the client's first name, last name, date of birth, and Medicare ID number, okay? The gender, okay? Now, as far as things that I recommend you don't use Sunfire for doctors or physicians lookup. Instead, use eHealth, which we'll go over in just a second. Simple reason being that Sunfire, unfortunately, is not 100% accurate as it pertains to that information. So I wouldn't recommend solely relying on that. You can certainly use it if you choose to, but you're going to do twice the work. So I recommend that you look up the doctors either on eHealth or on the carrier website directly, okay? I did a video on how to look doctors up on Humana, United Healthcare, as well as WellCare. So feel free to go back to those resources. All the other carriers have doctor lookup tools as well. They're very, very similar. We have the links available for you. So it's a super easy process, takes a couple minutes depending on how many doctors the client has, okay? And then also, do not use Sunfire to look up United Healthcare chronic plans, or don't rely on it, simply because unfortunately Sunfire doesn't populate them very well. So anytime you're looking at a dual plan and you're looking for United Healthcare, always use Jarvis just to get a second look to make sure that all plans are populated on Sunfire, because sometimes there's a couple that might be missing and I don't want you to miss out on an opportunity. Okay, so the only time that you don't want to use Sunfire for an enrollment that I mentioned to you already, when we went over the carriers, is with United Healthcare. Remember, because United Healthcare's health risk assessment can only be completed right after the application has been conducted on the Jarvis tool, okay? Or it's let me rephrase that. It can be conducted, I think up to a couple of days after, but the point is it doesn't populate a health risk assessment if you don't conduct the enrollment on Lean's website, which is in connection to United Healthcare's website. Okay, so you have to do it through United Healthcare's website, Jarvis, and then you'll click on Lean. Okay, and then the last but not least things is do not 100% rely on the accuracy with medications. If somebody has over 10 medications, we usually recommend that you use Medicare.gov simply because that's a little bit more accurate. So Sunfire has come out, guys, about, I think, a year and a half ago. Don't quote me on that, between a year and a half, maybe a year ago. It is a super, super helpful tool. There's so many organizations that use it. It's just nothing is 100% perfect, right? So it still has a couple of kinks that are being worked out. So just be patient, okay? All right, now how does the scope of appointment work using Sunfire? Okay, once you establish that the prospect is text or email savvy, find out if they have a smartphone, and if so, text the prospect the link. All right, ask questions like, now, Ms. Jones, if I send you a text message as we speak, would you know how to locate the text message? Okay, and if they do, then just follow these steps. Now, prior to completing the scope of appointment and sending it to the client, remember you want to instruct them on what they're about to receive, okay? We have to remember, and it's so vital, that they're on the other side of the table or of the phone, and they cannot see what we're seeing. They do not know how this works, okay? So you're working with seniors, they're a little bit slower, most of them. And then secondly, they don't see. If you think about signing up for a credit card or something over the phone, if somebody doesn't properly guide you through the process, you're going to be lost. And when you're lost, you're not going to feel at ease completing an application with someone that you're like, are they telling me the truth? Is this really what I need? Is this really what I want? So I take daily pride in educating my clients and advising them, okay? So a large portion of our job is to educate people. And this is part of the education where we're guiding them through the process as to what we are doing, okay? So ask the client, so now, Ms. Jones, I went ahead and sent you a text message. As soon as you get it, just let me know once you receive it, okay? And you see it on your phone. Now ask the client to open the link on the text message or email they just received and instruct them to do the following, okay? Now, Ms. Jones, you should have received a text message. Just let me know from a provider called Sunfire Matrix, okay? Let me know once you see that appearing on your text message or your email. Oh yeah, I got it right here. Wonderful, okay? That's awesome, awesome. Now, do me a favor and click on the blue highlighted link that you see on there, okay? And that link, right above the link, it'll read, to view your scope of appointment, please click the link below. This is the first blue link that they see. There is a second blue link, which would be your email address, okay? So make sure that that you're instructing them. It is the first link. It's a hyperlink with saying Sunfire Matrix. And I'll show you in a second what that looks like, okay? I took some screenshots. Now, you will see my name and number on there as well at the bottom of the page, okay? And again, it will say to view your scope of appointment, enter your personal code. Do you see that, Ms. Jones? Once they say that they saw it, you then provide them with the automated code, okay? And that code will appear on your screen, so you will have to give them, it's automated, so the computer generates that code, okay? Now, Ms. Jones, what I'm going to do for you, I will have a 6-digit code, okay, that I would like for you to put into it. So let me know when you're ready. And then guys, slowly you give them the number, depending on, you've now been speaking with them for a little while, you know how fast they are. So you got to kind of meet them where they are, okay? I'm talking pretty quick through here because you can always stop and go back and reverse or whatever. But the client, you have to make sure, if you recognize that they're talking slow, you have to talk a little bit slow because they're not going to get it otherwise, okay? And that's going to be a problem. All right. So then what you want to do as far as proceeding, ask the client to let you know what they're seeing next on the screen and provide the client with their personalized code, okay? So you give them the code. When you hear that they're saying, it's saying I need to put in a code, now you know, okay, they are on the link, they clicked on the link and the page has opened, okay? Sometimes they have some issues loading it or whatnot. We have to be very patient with them. These older folks, they use Facebook and maybe they email and sometimes that's it, okay? So you have to sometimes walk them through a little bit, and that's why it's so vital that you know exactly how it works, and that's why we're gonna be sending each other some text messages and emails so that you can truly understand how it works, okay? So it's really important that you understand the craft and the technology that we use, because if you don't use it, if you don't know it, or you don't know how to use it, and the client, then that's going to be set up for failure. And I don't want that to happen. I want you to be knowledgeable, or as knowledgeable as possible, hence me recording these videos here, okay? And be patient with yourself. It's new to you probably, so it's going to take some time to get accustomed to it, okay? It's totally fine. But once you do it a few times, you're going to get the hang of it, all right, cool. So now then the next thing, the Internet Explorer will open and then have the client sign their name. So basically they type in their first and last name, all right? And then scroll all the way down to the bottom and there's a green box that says save. They just hit that, and on your Sunflower screen, you will actually see where it says that the client has completed the application, all right? Now if you wonder what it looks like, here we are, all right? Now, Ms. Jones, do me a favor in your text message and hit the link, right? And once they hit the link, this is what opens, all right? Please enter your code to view your scope of appointment. All right, this is, now what's the personal code, Kevin? All right, Ms. Jones, the personal code is the number 6, the number 4, number 1, number 2, 3, 8. All right, you got it? Yep, I got it, perfect. Do me a favor and hit the blue button that says continue. Perfect. Now, once they hit continue, guys, that will lead them to a second page. So basically, a new page will load, which will be this one, all right? And this simply reads, I know it's a little hard to read here, but it's basically getting them to agree by signing this document that they authorize us to go over the information with them, okay? So where you see, and I always say, Ms. Jones, under the beneficiary authorized representative signature, do you see that? Yes. Okay, great. Type in your first and last name in that white filled box for me. Okay, great. Now, Ms. Jones, next thing I want you to do is scroll all the way to the bottom, and this is literally the end of the page. Do you see that green box that says save? Then they say yes. Okay, great. Hit that box for me, please. They hit the box and they're done. It's going to say, thank you for completing the scope of appointment ID. And that's all they have to do. Okay, pretty simple. Awesome. All right. Now, how does it work to do a Sunfire text and email enrollment? Okay, so we'll kind of go over it now. So we completed the scope of appointment. That's just for us to get permission to help them. The next step is to actually conduct the enrollment application, which works very similar, okay? Now, Ms. Jones, prior to completing the enrollment application and sending it to the client, remember, guys, we have to inform them what was about to happen, okay? You want to ask the client again to open the text message just as they did with the scope of appointment, as well as if they use an email, it's the same way. And just follow those instructions here below, all right? Now, Ms. Jones, what I'd like for you to do is enter your first and last name, your date of birth, and then a new page will open that says review your application. They scroll down to the bottom, they review it, make sure we spelled everything correct, the name, address, Medicare ID number, etc. And then there is a small box that says, I acknowledge that and I agree that I have read blah, 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 all right? And then all the way at the bottom, they just type in their first and last name, and a new wait page will appear with their confirmation number, okay? And again, on our end, as soon as a client submits it, our screen there will be something changing that will confirm to you that they have successfully completed their part, and I'll show you what we need to do on our end to sign, because we both need to sign, okay? Now, just if you're wondering, what does the text message look like? Here is, for example, that text message that I was talking about. So the dear client's name, click the link below in the following instruction. Here's that first highlighted link. and then underneath is your agent information, okay? And then basically for the enrollment signature, personal code, date of birth. So the system again will generate a personal code. They click continue, and that will then actually lead them to putting in their first name and last name and looking over the information. All right, we're going to do videos on that, so don't stress about it. I got you. Okay. Now, the next technology system that we use is Go High Level or High Level. Basically, it's a lead aggregation system that we call our CRM. Okay. It does allow you to make calls. It does allow you to send voice drops, so pre-recorded calls. It does allow you to send text message, emails. We use it to set appointments, right? So our virtual assistants, they set appointments, or when I used to make my own appointments, I used to set appointments on the weekends for during the week. Medicare, life insurance, it's all a numbers game, guys. If you have a specific number, if you have a specific goal to reach, you can call me and I can tell you how many leads do you need to buy a week? How many sales do you need to make? How many presentations do you have to have? And I can tell you, it's basically, I figured it out, right? I did the math and I've ran it quite a few, for quite a few years now. So I figured out how it kind of works, right? Same reason why doing AEP, I know exactly how many appointments I need a week in order for me to hit my target goal, okay? My goal is to enroll 4 people a day doing AEP, for instance. Well, this past AEP was more so 8 people because I had a different target goal. But so you need to make more presentations. The more people you speak with, the more presentations you give. That's really what it comes down to. The higher the chance for you to make sales, okay? And that leads to an income and clients on the book and hopefully some renewals and residual income, okay? Now it's also our lead database. So basically our leads are the documents that the clients fill out with their information that they're interested in receiving more information for us then to contact them as the advisor and go over what they requested, okay? And it also helps us with our retention automation system. So I have built out actually a 12-month program, so to say, where, for instance, the day after you enroll the client, they automatically get a text message. 2 weeks after, they get a text message and email. Hey, Ms. Jones, it's just Kevin, me, your advisor reaching out. I want to make sure that by now you got your member ID card in the mail. If you haven't gotten it, please let me know, because we don't have time to reach out to each of these individuals. We're over here focusing on gaining new customers. And so we let the system do the work and actually let the system reach out to those clients so that they can then return back or text back if they do need anything, okay? And we'll look at that in detail as well. Now, this looks a little confusing, but again, it's just a screenshot that will kind of a little bit tell you here how to conduct a phone call, etc., because it does allow you a lot, okay? So step 1 would be, once you log into Go High Level, select Contact Smart List from the menu bar, okay? The menu bar is located on the left-hand side where you see here Dashboard, okay? This is where you would select it from. Then you want to select the tag that you're working on. So very often we have basically a tag is basically a list of individuals that we have uploaded. As you can see, there's different dates, right? So a list of individuals that we uploaded for you to contact, okay? Or if you have your own leads and you uploaded them yourself, then you would go that route, okay? Then the next thing is you would sort those by last activity, meaning when you last called that client. So as you can see, the last activity is right here and that icon, okay? So your list of clients will basically, this is the first one, and then there's a whole bunch coming up, okay? And then here's your last activity, because you don't want to call the same people again. You want to call who you haven't been able to reach. And clearly you do want to call the other people as well, but you want to stop where if you go on lunch and you come back, you want to stop where you finished, okay? Not call the same people again that you just called an hour ago, all right? And then also you want to select the first lead and click on the green button, which is the call button, all right? So you have a screenshot up here in the top right corner. So once you click on the client's name, which is Ms. Jewel in this case, right? You will see the green call button right here. And basically, if you click that phone button, sorry, it'll actually call that client's personal phone number that they provided us with. Now, really, really important, you always call 3 times back to back, okay? If you call one time and hang up and go on to the next one, you can certainly do that. In our industry, if you want to have success, please follow my instructions. You want to call 3 times back to back. Don't let the voicemail ring. As soon as the voicemail comes on, click and call right again. What it does, it applies urgency, and a lot of people think, oh, it must be important. Somebody's calling 3 times. Will some people be upset? Yes, that's all right. You're going to laugh it off. Oh, my phone must not be working. I'm sorry. I didn't mean to. I didn't know it was calling 3 times. You're going to come up with some excuse, okay? But what it does, it gets more people to answer the phone, because a lot of the telemarketers, they only call once, okay? And we need to get on contact because they had requested the information. It's our job to get it to them. It's urgent, right? So we got to put some sense of urgency to it. Awesome. Now, once you call 3 times, guys, you would hit the next button. However, I have implemented something else, which I'll show you shortly. Once you've called that client 3 times, you will move them in our opportunities tab, which I'll show you what that is. You will move them to first call, no answer. What that will do after you call 3 times, it will send them an automated voice recording. You are more than welcome to record yours. Otherwise, they get my recording. Record yourself. Hey there, this is X, Y, and Z name. I've been trying to reach out to you. I have the script available for you. We can upload that to your profile here in Go High Level, and that will actually allow you to then basically send those recordings. As soon as you drag and drop it in that list or in that drop down, it will then send that, okay? Now, the goal is to call the clients 3 times back to back, about 3 to 4 times during the day. So morning, afternoon, evening time, because some are at the doctor, etc., right? So you want to call and touch on that client 3 times. So that is 9 dials, okay? 3 times in the morning, 3 times in the afternoon, 3 times in the evening. Each time you move them from no answer 1, 2, 3, they get a voice drop. So they know you're reaching out. And some of them even get a text message, okay? The goal is to, again, apply pressure and make sure that they call back and they know the number by the time you call again, okay? If you have any questions, you can let me know later. If you're looking for a specific client, you can always use the quick search. If you're looking for Ms. Smith, you can simply look her up here. And then if you need to filter anything else, you can certainly do that, okay? We'll do a live training there, so no worries. It's all new, and I know it can be a little complicated and overwhelming, okay? All right. Now, as far as the text and email capability, if you're planning on sending, for instance, group text messages using our CRM or group emails, you have that functionality. I recommend, if you choose to do that, just discuss it with me, because I'm paying for that, right? And it needs to make sense. And most importantly, we need to make sure we have it set up properly for you. What I mean with that, the system lets you customize, basically, since you're sending, like, we call it a bulk message, where it goes out to everyone. We want to make sure that Miss Janice, right, which is the 3rd person on this list, is not going to be greeted by Miss Ora's name, right? So there's certain functionalities that we have to set up for you that I will show you how it will automatically populate the client's actual name and what it's about and things of that nature. I have lots of templates for that, okay? But I just want you to know we do have that ability. So if you want to send a one-time message to all of those 21 individuals, we certainly can do that. And we do it all the time, okay? And then this is kind of just the steps how to do it. You at the top bar, search bar here, you would say send text messages. Next thing is you want to select all of your clients. So if you just click that icon here, instead of clicking each individual, it'll select all of them for you on the first page. And then to the right-hand side, there will be a button that says select all, as you can see, unselect, and that will select all pages, okay? And once it does, you basically will see send text message to the following contacts. So here's the first page usually, and then there's 11 more. So if you think this is the total amount of people, which you can see how many there is I was seeing it earlier right here, total context within that smart list, then you know that that's the right amount of people, okay? All right. And then as far as sending it, this is basically your text. You have some templates located right here, or you could just put in your message. Remember, we want to make sure. So for instance, this contact.firstname._name, that is, for instance, one of the configurations that you have to have, and it will pull their first name. All right. Good afternoon. Let me know what would be a good time. Da, 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 da. This is just an idea. Okay. What it would look like. Okay. We have so many different options how we can do this, but again, one thing that I recommend for you to do is don't reinvent the wheel. Reach out to me. There's a lot of people at IFG that had plenty of success doing these things. And so it's okay to be a copycat in this case, because there's no need for you to sit here and reinvent the wheel for something that's already working. Okay. Now, if you're setting your own appointments, if you have a spouse or somebody that's setting the appointments for you, or even one of our virtual assistants, I just kind of wanted to show you what this will look like on the screen as well, okay? After setting the appointment, complete the following steps. You want to, on the right-hand side of the appointment, click on the notes section, which you will see the notes section right here as well, okay? So basically, you have the client's information here. You click on the client, as I showed you earlier, the green button, it brings up a page, and this will be the page, client's information. And then to the right of the screen, you'll see activity, task, notes, and appointment. If you want to schedule an appointment, and I'm making a video of this, don't worry, you want to click here, add new. Once you add new, you basically select the calendar will come up here. You are able to select the time slot, and you want to make sure that it's your calendar showing, right? If you're on your account, it should show yours. I see everyone's. And then what time you want to make the appointment, on what date. And then if you already found out that the client told you while you were talking with them, oh, I have Humana and I want the food card and but I don't like United Healthcare, you can put that in here in the notes, because that will appear on your Google Calendar appointment. So when you call her, there's no need for you to show her United Healthcare if she doesn't like United Healthcare, right? So you don't want the client to say, well, I already told you I don't want X, Y, and Z. Listening is very fundamental in our business, because we need to find problems, and we need to find the problems or detect the problems that they have and the concerns, and then provide them with a solution. Okay, if you're good at doing that, at listening and providing the solution, meeting the client where they are, you're going to have success in the business. Okay, it's more about how you talk with them and that they know you get what they need and what they want. Then do you 100% understand the system? Do you know every product? Like, that comes later. I promise you, it is literally in the insurance industry, they say it's 80% setting the appointments or talking to people, right? And the other 20% is like a very small percentage, 5% of product knowledge and 15% of being able to communicate with somebody. And even the owner of IFG, Tyler Reese, right? Like, he tells the story all the time, which is so amazing. Like, when he was new in the industry back in the day, he didn't even know his logins to some of the websites, and he went into a house and promised the client, by the time I walk out here, I'll assure you you'll be in the best plan possible, and we're going to figure this thing out together, right? So sometimes it's not about needing to know everything right then and there. You just need to know how to communicate, okay? And I can teach you that I can teach you that to a certain extent, but even in the hotel industry, I used to always tell my people, I can teach you the system, but I can't really teach you to be hospitable from the heart, right? Either you have it or you don't. That's kind of the point that I'm trying to make. Okay. And then once you did set the appointment, you will see confirmation when the appointment was set, by whom, etc., and for who, etc. You'll see all of that, and I'll do a video again, so you'll see all that more in detail. All right. Now, this is kind of what I was talking about, where you drag and drop. Okay. So on the left-hand side, again, under the sales funnels opportunities tab, I'll do a video. Okay. You do have basically the ability to take this client, let's say you had an appointment scheduled and they didn't show up, you can move them over if they no-showed, okay? If you enrolled them into a plan, you can move them over that you enrolled them. So you would look at the icon that says enrolled, okay? I can't move over here because this is a screenshot, okay? So that's why it's so important that you mark all of your prospects on your Google Calendar. If you spoke with them, meaning you made contact with the prospect and the prospect is in the best position, you just couldn't help them. I cannot stress the importance enough, guys, that you take as many notes as possible, even if you can't help them. Meaning, if they tell you what plan they're on and you then research and that's just the best plan, write down what plan they're on in your Google Calendar notes, because just because you couldn't help them today does not mean there's not an opportunity in the future where you can help them. Medicare clients change all the time. They change plans all the time. They have questions. And if they can't reach your customer, they definitely want, they definitely would appreciate having your contact information, maybe reaching out to you, okay? The next one is enrolled. So meaning if you enrolled the client and the prospect agreed to it, you want to make sure you complete the scope of appointment and enrollment, and then you drag the client over to enrolled and you type enrolled in front of the client's name on your Google Calendar. Okay. Next thing is no show. If you call 3 times back to back, no response. Remember, we have those 3 times drag and drop, which you'll see in the video. And that will actually then show you that the client is a no-show. So eventually, if you have an appointment setter, they would call those no-shows back. Otherwise, in your downtime, you would actually call those clients in between appointments whenever you can. I never sit still. I'm always being active because the more people I talk to, the more people I get on the phone, the higher the chance that I'm going to convert something into a sale. Okay. So just because somebody didn't answer, I'm not going to go have a smoothie or coffee or whatever. I'm going to try and see how can I create some activity, because activity leads to sales. Okay. Your attitude and your activity is what converts. Okay. If you have a good energy, the clients can feel. If you're a negative Nancy, Debbie Downer, you can call it what you want, but you have to be in a good mood. That's why it's important that in the mornings, I don't care what you do, if you meditate, pray, whatever you do, you have to make sure that you're ready each and every day to tackle the day. Because if you show up with a Larifari kind of energy, then that's how your day is going to go. Okay. And for me, it has proven that if I don't start my day right, then it's going to drag through the entire day, which is going to be problematic because I'm going to end up with 1 sale a day and I'm not going to be satisfied because that's going to mess up my numbers. Okay. And then if you do set appointments, guys, under section D, you see appointment scheduled. You set the appointment with the prospect. There's nothing that you put in front of the name. You would simply, as you guys can see here below, the appointment was scheduled. So you would just leave it as that and put it on the calendar as you saw in the couple of steps before. Okay, I'm doing a video. It'll all make more sense, but I want you to at least have something that you can go off when it's time for you to actually enroll people, or you're making calls and like, wait, what was I supposed to put in front? You can come back to this presentation that you'll have a PDF copy of as well. Okay. All righty. And then once you spoke with a prospect, go into the opportunities tab, okay, which is also called a sales funnel, and then use the search bar, enter the prospect's name that you last spoke with, and drag the prospect to which best describe the circumstance that we just went over, okay? So here in this case, let's say you don't have an appointment booked and you're calling and you're going for it right away, they're available to talk, and you did enroll them, you just literally want to take this person and drag them. As you guys can see, there's the next one, etc. So you literally just take them and drag them over, and then it'll automatically place them here. What it does, again, depending on how you have the CRM set up, it will automatically send them notifications, reminders, etc. Okay. And then also it on the back end creates basically for us lists to ensure that we can help you with tracking to make sure that your client is active and things of that nature. All right. All right. All right, guys. So the next thing that I want to look at is called, excuse me, Medicare.gov. As you heard me mention that name before, like when we were on Sunfire to look up drugs, for instance, or to compare plans. So Medicare.gov is a great tool. It serves as a plan comparison tool as well as a medication formulary lookup tool. You do not need to have a login to compare plans. I have a lot of ginger in my smoothie. You do not need to have a login to compare plans. You can simply hit continue without logging in. I'm making a video for you, okay, so that you know exactly what I'm talking about. But as you can see on the right-hand side, it does not, it does offer you, once you put in all the medications, etc., it does show you how much is the monthly premium plan for this is a prescription drug plan, PDP, right? How much would the client pay on an annual basis for their medications? It's $29.20. And is there a deductible? In general, there's a $445 deductible. Clearly, if the meds only cost $29 a year, they would not pay $445. I hope that makes sense. Okay, when we'll go into more detail at a later time. All right. And then another thing is that allows you, if a medication is not covered on the formulary, I always like to look up for clients, and if I see a medication is super expensive or it's not covered on the formulary, one thing that I like to do is basically go on GoodRx. It's a site that allows you to find basically coupons, okay? They can either download the GoodRx app on their phone if they have a smartphone, or alternatively, they can print out the coupon and take it to things like Walgreens, CVS, Walmart, etc. Okay, and I've been able to save a lot of my clients money, and even a couple of people at IFG that are a little bit older, they even use it. Okay, so it definitely works. Okay, so you would simply put in the name of the medications in the top, and then you would see this different pharmacies listed, and you'll see here how much is the discount. So in this case, I don't remember what medication I was looking up, but as you can see, it's pretty expensive, right? So then you would just simply say, oh, based on what I see here, Ms. Jones, Kroger, do you have a Kroger nearby? Yes. Okay, great. Kroger has the medication as $3,959. That seems to be the least expensive one. Next to Kroger, you are looking at Costco. Do you have a Costco membership? No? Okay. Well, then the next thing would be either Safeway, right? So you would just look here. Awesome. All right. And then I think the last, if not a couple more, tools that we use, you won't be using this too often unless you're focusing on the Medicare supplement side. This is the quoting tool that we use. So we do not use Sunfire for Medicare supplements. We only use Sunfire for MAPDs and PDPs, prescription drug plans. So you would get your credentials or you would actually request your credentials down here. You put in your username and password. Always, always, always zip code, county, and the age of the client, okay? And that will actually, or the date of birth, that will actually tell you how much a supplement plan is. Remember, all supplement plans are, depending on the category, G, N, they're all the same. The only difference is that they're all the same if you stay within one category, such as N's, G's. They're all the same. The only thing that differs is the price, okay? So you always, if you do happen to talk to somebody that is on a supplement, you can always say, wow, that's wonderful. I commend you on having a supplement. Now, do you happen to know if you have a plan G, N, or F? Oh, I have a plan G. Great. That's wonderful. What company do you have that with, Mr. Jones? Oh, I'm with Aetna. Oh, wow. That's a good company. I have a lot of clients on that. Always commend them, okay? Always speak positivity into them. You don't want to speak lack. You don't want to make them think you're about to take something away, because a lot of agents and advisors and marketers, they're always trying to replace what somebody has. So by speaking life into them and speaking positivity and commending them, you're going to make them feel good. And think about it when you walk down the street and somebody tells you, hey, I like your shoes, I like your glasses, hey, I like your hairstyle, something like that. It makes us feel good, and it costs us $0, right? So we should do more of that in general, including myself. I need to do more of that. But always commend them. Don't Don't, when they tell you already have one, wow, that's wonderful, Ms. Jones. I bet that helps you out a lot if they have a food card, right? You'll hear me. I say, like, with the cost going up, with the increase in the inflation, I can imagine that that $125 food card helps you out a little bit, correct? Yes, you get them to agree, because what you want to do throughout your presentations, you want the client to nod with you, right? The head, instead of doing no, right? The more you get them to agree with you and go with you, the more they will trust you, and they will actually at the end just say, yes, go ahead and enroll me, because I, whatever you say, that's where you want to get to, okay? And you do that by being nice and by commending them and by having conversation. And one great thing that I always do is, or often do, is when I ask questions, I always also answer the question. So now, Ms. Jones, are you from Georgia? Oh no, I was born and raised in Alabama. Oh wow, that's interesting. I have a friend that's from Alabama. And he actually now lives in Georgia, for instance, right? Now I'm from Germany, Ms. Jones. I've been in the States for about 10 years, and I lived out of the 10 years, 8 years in Georgia. Give a little bit of insights about yourself, right? So that way they know who they're working with, because just asking the question and not saying anything about yourself, I always think that's kind of like one-sided. And you want them to get to know you as well, right? And if you hear dogs barking and you hear kids in the background, always try to find some kind of commonality, or where you guys have a mutual interest, even if you don't, right? Facts tell, stories tell. You hear me say this all the time. Bring up a quick story of your auntie, whatever, even if it's a family member, extended friend, a story that you heard. Make it your own, add your juice to it, right? Because that is really what gets the client to feel comfortable with you and wanting to work with you. There's so many people calling them each and every day. So we need to make a difference. And these are just a couple of little tidbits how we can make a difference. Okay. Now, the next one that we're going to look at is eHealth. eHealth is basically what we use it for. eHealth is a company, but we utilize their tool to look up doctors. Okay. It's pretty accurate. So it does allow you to put in multiple doctors. So that is the beautiful thing. As you saw earlier on the carrier websites, unfortunately, you have to put in one doctor or provider after another. The problem with that is if you have 7 doctors and you put in 1 through 6, they're all in the network, and then you put in number 7, and that one is not in the network, and the client will only move to the new plan that you're suggesting. If all are in the network, now you got to start all over with another company or another plan within that company, right? Whereas with eHealth, it does allow you right here on the right-hand side to put in all doctors at the same time. And then right here, you'll see how many plans does this doctor actually accept. I'm going to do a video on this for you guys, okay? So don't worry. But basically, you will see here you will see the name of the plan, and then if the doctor is in network or not. If it's a network, it's going to be a check mark. If they're not in network, you're going to see an X. It is about 90, I would say, % accurate. So again, if there's one that's not in the network, I always recommend calling and or checking the carrier website, okay? Another thing you have to make sure, as it states right here, that you do click MAPD, MS, which is Medicare Supplement PDP, from the dropdown, so that you know specifically what you're looking for. But again, I'm doing a video on it, so that way you're able to see exactly the breakdown, okay? Awesome. This will conclude our tools. This will complete our tools training for today, guys. If you have any questions, as always, I hope you've written them down. If you need me to specify, clarify on anything, I'll be happy to do that with you all. Shoot me an email or just simply use my calendar link and set up an appointment on my calendar so we can do a one-on-one. I don't mind at all. And then there is a couple of additional tools that we use to like communicate. For instance, we use Slack. It's just a group communication chat where basically we provide you with login credentials, and then on a daily basis we communicate in there. As always, if you need anything immediately, shoot me a text message, give me a call. I am on the phone a lot, so text message usually works best because I can just simply text you back while I'm on the phone with a client or something. I had a couple of calls right now from clients that had called me. And that's one other thing that I want to bring up is we have the ability to connect your Go High Level system with a Google spreadsheet, so to say, where those clients that are now your clients, they are added to your cell phone as contacts. So when they call, the client's name actually appears on your phone, okay? Which is kind of wonderful because you know exactly who's calling. Hey, Miss Mary, how you doing today? How can I help you? Or whatever the case may be, okay? But yeah, let me know if you need anything and I will talk to you guys soon.